Now we'll look at two tests that are very important in orthopedics, and this is the Apley test. The other one is what? Thessaly test. Okay. Apley test. The other one is what? Thessaly. So let's look at them. So you can see that they are always together, always together, the Apley test, the other one is what? Thessaly. So let's look at these two tests. The other one is what? Murray. All of them is basically to see if there's anything wrong with the knee or the meniscus, to be specific. Okay, so this is Thessaly, this is Apley. So Apley, the person is lying down, you are doing it by yourself. While the Thessaly, the person is kind of like standing up and you're trying to examine the person by yourself. So both of them, you should know that what they are used to evaluate suspected meniscal tears, in the knee. Okay, so but they actually differ in how they are performed and also their accuracy. Okay, so the Apley test is also known as Apley Compression or grind test, to dictate meniscal injury. So the patient lies face down, the knee is now flexed. Okay, so after this is flexed, the examiner applies downward pressure on the heel while rotating the tibia. Okay, so pain or clicking sound suggests that there is a tear in the meniscus. Okay, this is Apley we are talking about. All right, so it's often combined with other tests like the Murray and all of that. Now I'm moving to talk about the Thessaly right now, so please observe the picture. Okay, so for the Thessaly, we said that it also screens for meniscal tears. So the patient is standing on one leg with the knee flexed to about 20 degrees. So the patient rotates the body and the knee internally and externally 3 times. Okay, so if there's pain, locking or catching, indicates that there's issues with the meniscus. Right, so it mimics functional knee movement, so it can be more sensitive than Apley's. Requires patient balance and cooperation. Some studies suggest what? Higher diagnostic accuracy compared to even Apley's, okay, and Murray's. So that's it for the Apley's and the Thessaly test.